Hello, and thank you for choosing safety training seminars for your CPR and first aid training needs. For CPR, we are going to cover compressions, rescue breaths, and the use of the AED for the adult, child, and infant. During our first aid segment, we're going to cover basic first aid skills such as choking, bleeding and bandaging, the use of an EpiPen, and glove removal.
You may want to rush in to help someone, but make sure the surroundings are safe before doing so. Remember, look up, look down, look all around, make sure no danger can be found. After making sure it's safe, approach the collapsed individual and check for responsiveness. It's best to firmly tap on the person's shoulders while shouting, "Are you okay?" If there's no response and you are alone, call 911 and put your phone on speaker mode so that your hands are free to assist the injured individual. If there are others around you, point and instruct to a specific person to call 911 for you. It's also a good idea to ask for an AED at this time.
There are slight differences in the assessment between adults, children, and infants. Let's define each age group. Infants are less than 1 year of age. Children are above 1 year of age to the onset of puberty. In biological males, signs of puberty include body hair and muscle tone. In biological females, it tends to be breast tissue development. Once signs of puberty are present, that person is considered an adult. CPR for an adult is as follows. First, always make sure that the scene is safe before you approach the injured person. When we know that it's safe to approach, we can check for responsiveness by performing the tap and shout. Are you okay? If this person is not responsive, call 911 on your cell phone, put it on speaker mode so that the dispatcher can give you instructions and you have both hands free to assist the person in need. Now we're going to check for breathing. We want to scan the chest for at least 5, but no more than 10 seconds, looking for chest rise and fall. If this person is unresponsive and not breathing, we're going to start chest compressions. Chest compressions are performed on the lower half of the breastbone above the bottom of the rib cage. Using the heel of your palm, start to perform chest compressions. You want to go to a depth of at least 2 inches or 1/3 the anterior posterior depth. You want to go at a rate of about 100 to 120 compressions per minute. Our mannequins have sensors in the center of the chest and on the left shoulder to let you know if you're performing compressions at the proper depth, rate, and speed. Place the heel of your palm on the center of the chest, on the lower half of the breastbone, above the bottom of the rib cage. Support your first hand with the second and push straight down. You'll hear a clicking sound to let you know that you're pushing down at the proper depth. Our mannequins also have a series of LED lights on the left shoulder. 2 green lights indicate proper depth, rate, and speed. A red light indicates you're not pushing down deep enough. If you only see a single green light, your compressions are too slow. If you see a flashing yellow light between the 2 green lights, your compressions are too fast. Your goal is to get 2 solid green lights. There are several techniques you can use to give rescue breaths to an adult. The first is mouth-to-mouth rescue breathing. Pinch the nose, tilt the head back by lifting the chin to open the airway. Seal your lips around theirs, and you get to attempt 2 rescue breaths after 30 chest compressions. You're going to look for chest rise and fall with each breath. Another technique is using a simple barrier device. When you open the packaging, you'll find a thin plastic sheet with a one-way valve in the center. Place that one-way valve over the mouth, pinch the nose, perform the head tilt chin lift to open the airway, and after 30 compressions, you get to attempt 2 breaths, looking for chest rise and fall. Another technique is using a simple pocket mask. Don't forget to attach the filter to the neck of the pocket mask. Make sure it's secure. The pointy part of the mask goes to the bridge of the nose. The bottom half lines up between a patient's lower lip and chin. Make sure that you push down with enough pressure to make an airtight seal. Perform that head tilt chin lift, and you get to attempt 2 breaths looking for chest rise and fall. The last technique is using a bag valve mask. If it's available, all you have to do is attach the pocket mask to the neck of the bag valve mask. Again, the pointy part goes to the bridge of the nose and the bottom half between a patient's lower lip and chin. After 30 chest compressions, push down to make an airtight seal. Perform that head tilt chin lift. First breath, second breath. 30 compressions, first breath, second breath. 30 compressions, first breath, second breath. CPR for a child is as follows. Always make sure that the scene is safe before you approach. When you know that it's safe, go ahead and approach the child and perform that tap and shout. Are you okay? If the child is not responsive, we want to go ahead and get help by calling 911. Once we know that help is on its way, we want to put the phone on speaker mode so that the dispatcher can give us instructions and we have both hands free to assist the child. Now we're going to check for breathing. We want to scan the chest for rise and fall for at least 5, but no more than 10 seconds. If the child is not breathing, we want to start CPR. Chest compressions are performed on the lower half of the breastbone above the bottom of the rib cage, and you want to perform your compressions to a depth of approximately 2 inches or 1/3 the depth from the front to the back. Using the heel of your palm, place that again on the lower half of the breastbone. It's acceptable to use one arm for a small child. If you cannot compress to a depth of approximately 2 inches or 1/3 the anterior-posterior depth, use both hands for compressions. You want to perform compressions at a rate of approximately 100 to 120 compressions per minute. There are several techniques to give rescue breaths to a child. The first technique is mouth to mouth. Simply pinch the nose of the child, tilt the head back, lift the chin slightly, seal your lips around theirs, and attempt 2 rescue breaths. You should be able to see chest rise and fall. The other technique is using a simple barrier device. When you open up the package, a simple barrier device is a thin plastic sheet. You'll see a one-way valve which goes over the child's mouth. Again, pinch the nose, tilt the head, lift the chin slightly, and attempt 2 breaths, looking for chest rise and fall. The other barrier device is a simple pocket mask. They often come with filters that you simply attach to the top. The pointy part here lines up with the bridge of the nose, and the bottom part you want to place that below the lip and above the chin. Again, after you've made a seal by pushing down, tilt the head back and attempt 2 breaths looking for chest rise and fall. The last piece of equipment is a bag valve mask. You can often find these in emergency first aid kits. Same technique with a simple pocket mask. Line the top at the bridge of the nose and the bottom between the lower lip and chin. Tilt the head slightly and you get to attempt 2 breaths, looking for chest rise and fall. So after 30 compressions, 2 breaths, first breath, second breath. 30 compressions, first breath, second breath. CPR for an infant is as follows. Always make sure that it's safe before you approach the injured infant. Once you know that it's safe, you can go ahead and check for responsiveness by tapping the bottom of baby's foot. This is a painful stimulus and the baby should cry, wince, or move around. If there's no response from the infant, we want to call 911. Using your cell phone, dial 911, put it on speaker mode so that both of your hands are free to assist the infant. Now we want to check if the infant is breathing. We want to look for chest rise and fall for at least 5 seconds, but no more than 10. If you do not see breathing within this time, we want to go ahead and start chest compressions. We're going to use 2 fingers for the chest compressions, center of the chest, and you want to push down at a depth of approximately 1.5 inches or 1/3 the anterior posterior depth from the front of the chest to the back. When you perform these compressions, you want to go at a rate of about 100 to 120 compressions per minute. There are several techniques to give rescue breaths to an infant. The first is giving rescue breaths using mouth to nose and mouth. You're going to seal your lips around the nose and the mouth of the infant, making an airtight seal. Tilt the head back to the neutral or sniffing position, and then you get to attempt 2 rescue breaths looking for chest rise and fall. Another method is using a simple barrier device. Once you've opened up the packaging, you want to line up the red one-way valve over the baby's mouth. Again, tilt the head into the neutral or sniffing position, and you get to attempt 2 breaths, breathing through the red one-way valve. Another technique is using a simple pocket mask like this one. First, attach the filter to the top. Pointy part of the mask lines up with the bridge of the nose of the infant, and the bottom half of the mask you want to line up between the lower lip and chin. Covering both the nose and the mouth, tilt the head into the neutral or sniffing position, and then you get to attempt 2 breaths looking for chest rise and fall. In some first aid kits, you'll find a bag valve mask like this one. Attach the simple pocket mask to the portion where the air comes out. Line up the tip on the bridge of the nose of the infant and the bottom between the lower lip and chin. So after 30 chest compressions, line up the mask, tilt the head into the neutral or sniffing position, and you get to attempt 2 breaths, looking for chest rise and fall. 30 compressions, breath and breath, 30 compressions, breath and breath. There are slight differences in the assessments between adults, children, and infants. One of the differences is the recommendation for witnessed versus unwitnessed collapses. In general, adults, children, and infants go into cardiac arrest for different reasons. In most adults, cardiac arrest is due to heart issues. Getting help right away is the best way to promote survival. If you're alone, do not have a cell phone, and no one hears your shouts for help, leave the adult to get help right away. In contrast, most children and infants go into cardiac arrest due to respiratory issues. Getting oxygen flowing through their system is the best way to promote survival. If you witness a child or infant collapse, you know they still have residual oxygen in their bloodstream, giving you time to get help when no one else is around. So if you're alone, do not have a cell phone, and no one hears your shouts for help, leave the child or infant right away to get help. However, if you do not see a child or infant collapse, it's an unwitnessed event. You have no indication as to how long they've been down. It's unknown if they still have some oxygen left in their system. For the unwitnessed collapse, it's best to perform 2 minutes of CPR first, allowing oxygenated blood to flow into vital organs. If no one arrives during the time you're performing CPR, you can leave to get help yourself after performing 2 minutes of chest compressions. Please also note that because the collapse was unwitnessed, do not pick up the child or infant and carry them to help. They may have a head, neck, or spinal injury. Also, the parent or guardian may have left to get help. If you pick up the child or infant, the parent or guardian will return to the scene with the child or infant missing. Another difference in CPR between adults, children, and infants is in regards to the use of the AED. As always, turn on the AED and follow the verbal prompts. The difference comes in pad placement. For the adult, you want to place the first pad on the right shoulder. The second pad goes on the lower left. In contrast, for children and infants, you want to place one pad in the center of the chest and the other pad in the back between the shoulder blades. To use an AED, an automated external defibrillator, turn it on and follow the instructions it gives you. Once the AED arrives, open the carrying case, turn it on and follow the verbal prompts.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Remove packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures. Remove packet and apply pads onto press pads firmly on skin. Apply pads as shown in the pictures. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm.
Analyzing, stay clear.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
Charging, stay clear.
Press the flashing shock button. Press the shock button now.
All clear.
Shock delivered. Begin CPR.
In some cases, AED pad placement may be affected. If the person has a hairy chest, the pads may not stick properly. In most AED kits, a razor is included. Quickly shave the hair and then place the pads. If no razor is present and there are 2 sets of pads, apply the first set and quickly pull them off to remove the hair. Grab the second pair of pads and place them correctly. If you see a pacemaker or implanted defibrillator, simply avoid putting the pads directly on top. In cases of medicine patches, remove them with a gloved hand and then apply the AED pads. Remember, never put a pad on top of a medicine patch. When someone's submerged in water, like a swimming pool or puddle, they must be removed and placed onto a dry surface before using the AED. To assist a choking adult, first make sure the scene is safe. Ask them if they're choking and if you can help. Are you choking? Can I help you? You then want to pick up the person and stand behind them. Make a fist with your thumb side in, and you want to place that fist above the belly button, below the bottom of the rib cage. Standing behind them, place 1 foot forward and 1 foot back so you have a nice solid base. Support your fist with your other hand. Firmly pull in and up. Make about 1 attempt per second, and if the object does not become dislodged and the person becomes unresponsive, move them to the ground and start CPR. To assist a choking child, first make sure the scene is safe. Then ask if the child is choking and let them know that you're there to help. Are you choking? I'm going to help you. Make your way behind the child. You can either stand or kneel behind them, depending on the height of the child. Make a fist with your thumb side in, place it above the belly button, below the bottom of the rib cage. Forcefully pull in and up until the object becomes dislodged. You make about 1 attempt per second. If the object doesn't come out and the child becomes unresponsive, lay them down on the ground, begin CPR. An infant who's choking will have changes in skin tone. They may also appear weak or dazed. In some cases, infants will have what's called a silent cry. This is when baby looks like he or she wants to cry, but little or no sound comes out. To assist an infant who's choking, grab the infant, have a seat. Grab around the angle of baby's jaw to support the head. Also, supporting the body weight with your other hand, lift them up. Rest baby face down on your forearm. Rest your forearm on your leg. Between the baby's shoulder blades, we want to deliver 5 back slaps using the heel of our palm. 1, 2, 3, 4, 5. Grab the back of baby's head, secure them between your arms, flip them over, tuck in, and we'll deliver 5 chest thrusts with 2 fingers at the rate of about 1 per second. 1, 2, 3, 4, 5. We'll look at the airway to see if the object has become dislodged. If we don't see it or if we're unsure, we're going to repeat the 5 back slaps. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. We're going to repeat this process of 5 back slaps and 5 chest thrusts until the object comes out or until the baby becomes unresponsive. If the infant becomes unresponsive, we'll lay the baby down on a firm flat surface and begin CPR. First aid is the initial action you perform to assist an ill or injured person before advanced help arrives. The goal with first aid is to minimize and manage injuries, preventing further harm. First aid actions will vary depending on whether the injured person is conscious or unconscious. For the conscious person, ask if you can help. When consent is given, you can address their first aid needs. For the unconscious person, you have implied consent that you can assist. Good Samaritan laws protect you when acting in good faith to help an injured person. EpiPens are used for severe allergic reactions. Common allergic reactions are environmental and food allergies like bee stings and peanut allergies. To use an EpiPen, follow the instructions on the pen itself. First, you want to remove the blue safety cap. Firmly grip the EpiPen, avoiding the orange tip. You want to inject above the knee, below the hip on the outer thigh. Press and hold until you hear a clicking sound for 3 to 5 seconds. 1,
2, 3, 4, 5. Pull the EpiPen out. The orange sheath will cover the needle. Rub the outer thigh. Dispose of the EpiPen properly. Bleeding and bandaging for minor cuts and scrapes. First, apply direct pressure using gauze. Grab some gauze and apply direct pressure to the injury. If you lift up your hand and it's still bleeding through the gauze, grab a few more and apply firm pressure. If you're having a hard time stopping the bleed at this point, call 911. In most cases, the bleeding will stop and you can put the gauze in place using a bandage roll. Having the cloth on the bottom, begin to unroll the bandage around the injury. Cover the surface area of the gauze that you laid down. Make sure that the bandage roll is secure but not too tight so that it cuts off circulation. Once the gauze is secure, go ahead and tuck the bandage roll in on itself. To remove soiled gloves, always point your hands down so that the splatter hits the ground. Pinch the cuff of the opposite hand, pull straight down, crumple up the first glove into your gloved hand. With your second ungloved hand, use 1 or 2 fingers to slide underneath the cuff of the gloved hand and roll it over. Dispose of gloves properly in a plastic bag or a biohazard bag, and don't forget to wash your hands afterwards.